Hi everybody, my name is Fred Munch. Very grateful to HITLAB for convening this panel of very accomplished experts in the area. We're going to be discussing digital technology and mental and behavioral health and where we think the direction of new technologies and the integration of providers and technology will go. Briefly, I'm going to let each of the panel members introduce themselves and give an overview of their organization, but I do want to highlight this is a very interdisciplinary panel of what I would call unicorns, people who understand technology, mental health, direct service, entrepreneurship, and technologists. And one of the things that strikes me about this panel as I was reading all the bios, and I've had the pleasure of working with some of these gentlemen, is that that knowledge of different areas and integrating that into the work they do, and how important that is. So without further ado, I'd like each member to introduce themselves, give a brief overview of the organization, and then we'll dive in.
So I'm Gary Dolkin. I'm the Deputy Commissioner of the city's health department, overseeing mental health. Among other things, we've been instrumental in launching in New York City a very ambitious public health approach to mental health called Thrive NYC, which is a pretty ambitious effort by any city to really take on population mental health as a problem and as an approach. Very interested in the ways technology can help our mandate, which is to worry about the population's mental health. And how do we impact that? What is most common? Where does it distribute? Who's most affected? And how do we address it in a public health way, as well as at the same time being the ones vigilant about those who are marginalized and may fall through the cracks of the system, people with more serious illness and other affected groups, people in the criminal justice system, homeless, other marginalized groups. So all of that speaks to the need to reach out and to connect, to get things to people outside of usual places where care happens. And we're very interested in how we as a city promote and accelerate the ways technology, information technology can help us do that.
Hi everyone. Good being here. My name is Danish Munir. I'm the Vice President of Technology at Genoa Telepsychiatry. We were formerly called One Docway. We were acquired last year by Genoa Healthcare. Our story is Genoa has been around for 15 years, serving the mental health population in America through the pharmacy side. We build pharmacies that are on-site at community mental health centers with the idea that if you can be in touch with the patient as soon as they're getting their care, at the point of care, you can develop better interventions, you can improve the adherence rate, which is a significant problem in all chronic conditions, but specifically in mental health. On the telepsychiatry side, which is my area, it's One Docway. We founded that 5 years ago with the mission of increasing access to healthcare, mental health care in rural areas. So over the past 5 and a half years, we've served about 50,000 patients in 15 states. Our patient population is primarily a Medicaid at-risk population. These are patients who are often living under the bridges or not getting any care at all. And these community mental health centers are really sort of the touch point for them, where they're coming in and trying to get their care. Unfortunately, a lot of these settings that already exist are funded have a very hard time recruiting providers. They can't get hold of a doctor. They have really good intentions, they have really good people, but they can't get hold of doctors. And that's kind of where we come in. We go and give them the technology, but most importantly, we go and find them the providers nationwide that can help meet the need. So as you think of the spectrum of companies and organizations trying to serve mental health, there's the technology side, and then there's sort of like the entirely human-based interventions. We're somewhere closer to this end of the spectrum, where we are using technology as a layer, but our delivery mechanism is entirely people, where we're focused on manual interventions, taking patients where they are today, and trying to get them to a place where other companies can sort of scale more technology-based interventions. And I think that makes it even handoff for Oren.
Thanks, Danish. Good morning, everyone. My name is Oren Frank. I'm the co-founder and CEO of TopStips, which was launched in 2012. We're very big believers in psychotherapy. It's an extremely valuable and helpful service almost to anyone and everyone at some point in life. And I think the barriers to entry to psychotherapy are very known and very similar to the rest of the discussion here. It's basically access, or the convenience of access, which Danish just mentioned. Obviously the cost, and thirdly the stigma that's still very much alive and well in 2016, unfortunately. So we ended up with a platform that basically creates a new modality of interactions between licensed therapists and clients or patients, mostly via messaging, heavily focused on text, but also video and audio. And this is a direct-to-consumer platform, not necessarily through any payer or provider or existing organization. In the last 4 years, we've treated over 500,000 people. We have a national network of therapists of over 1,000 therapists in every state in the United States. And what we see is that typically, if you look at, if any of us guys here will try and get an in-network or even a privately paid therapist in New York City, it's probably going to take us between 2 and 3 weeks to get to the first meeting, which a third of us won't make it or won't get there. And the engagement or the level of the intensity needed to create a real relationship, a working relationship, an alliance with the therapist is so difficult to achieve in the current distribution model of psychotherapy that we just had to try and come up with a different metaphor for that. So if you download the Talkspace app, it'll typically take you 2 to 3 minutes to talk to a matching therapist, which will overcome another very big barrier, which is a qualitative match for you. First of all, understanding what is your situation, do a proper intake, qualitative match, and typically within 2 or 3 hours at the same day, you'll start therapy with a licensed therapist by our modality. Typically, the cost is around probably between $30 and $40 a week. So roughly around the cost of copay, assuming you are insured and assuming you can get your insurance company to actually reimburse you for therapy beyond 3 or 8 sessions. So we see a lot of success in getting to audiences and populations that have never been treated before. I'm particularly proud of the fact that almost 60%